I'm Peter, I'm age 70, I'm retired. My orthopaedic specialist told me that my lower spine was a mess. I got scoliosis and degeneration of the lower vertebrae, and that I would have acute chronic pain. Naturally I was a bit upset at that, but I was introduced to Julie, an acupuncturist, through a friend who told me that don't despair, she could do things for me.
That was where the
That's
really,
what it was, yes.
really sticky out bit was. And you can see it, you can just see it a bit.
I was sceptical of before I came for my first session, but after a few sessions I realised that I didn't have any pain, and I also felt a lot better after each session, so I've continued with them.
So it's quite difficult to answer the question of how acupuncture helps a specific condition. Obviously that's how acupuncture's researched. We have, for example, all the research on back pain that was supported by the National Institute for Health and Clinical Excellence, a NICE guidance 88 that recently came out that suggested that doctors do recommend acupuncture for lower back pain. I think the trouble people have with acupuncture is that they struggle with some of the language. So they'll hear about, you know, qi, we're affecting the qi in the channels of the meridians, something like that. And it does sound a bit weird, but actually what we're doing is just using a language that all acupuncturists will understand. It was a medicine that was developed in East Asia, so they're Chinese terms. It's a very rich language and it doesn't translate that well sometimes. But if you actually look at Western medicine, they use Greek and Latin terms usually. And in fact, the Latin for pelvis is wash basin. So pelvis means wash basin. And you know, you wouldn't take that seriously, would you? If someone said, oh, I've got wash basin pain. So it's the words that we use, they're not kind of mysterious concepts that, you know, don't exist in biomedicine. We're not talking a different language. Well, we are talking a different language, but we're really talking about the same things.
I was not aware of the British Acupuncture Council when I was introduced to the acupuncturist. I've since realised that it would not be advisable to go to anybody who wasn't a member of the British Acupuncture Council. One of the curves in my spine, sort of halfway down the spine, made it very painful to lean against anything hard-backed, and I was aware that I had to be very careful in leaning back. Since I've started the sessions, that curvature seems to have almost disappeared, and I now have no qualms about leaning against hard-back chairs or walls. I'm very sceptical about how acupuncture is claimed to work, but I know it does work.